provides neuropsychological testing and treatment for children, teens, young adults, and adults in her private practice on Cape Cod, where she has been in private practice since 1996. We will actually get a glimpse of her beautiful practice setting a little later tonight. So, but without further ado, thank you, Dr. Mary, for joining us tonight, and welcome.
Thank you, Courtney. I am so honored to be here. I think this is a great opportunity. I love talking to parents. It's one of my favorite things to do, anything to help the kids and to help families. Thank you, Dr. Murphy, for this wonderful organization. I often refer to Effective Effort Consulting. They do wonderful work, and I'm just so pleased to be here. So today I'm just going to go through a number of slides. So you'll have some information in front of you. So just know that, instead of scurrying around and trying to take, copious notes, you will get the slides. So, I'm one of those people who take the notes anyways, but so whatever you'd like to do, that's great. I just have a few things to say as an introduction before we jump into the slides and get into the sort of meat of the talk. Sort of like three general important things that I want to emphasize that I'll get back to at the end about neuropsychological assessment. So I was trained up at Cambridge Hospital doing the neuropsych, and I worked with a wonderful man, David Dinklage. And he would always talk about neuropsychological testing, not just as an assessment, but as an intervention. And I think that's really important to remember. Sort of a lot of things can come out of it. But the second important thing about neuropsych testing is that, the end goal is always to provide support. It's not just an academic endeavor, obviously. We want to provide as much support as we can to the people that we're testing. And then the third is that we identify strengths equally as compromises or challenges. So the idea that we want to identify strengths in order to offset any challenges that might be presenting. And so those are three important ideas that I wanted to convey. So Courtney, we could sort of start with the slides.
All right, sounds good. You see the slides now?
I think, yeah, I can see the slide. Can everyone? I think everyone does, right?
I can see them.
Yep. Okay, great. So yes, so that's me. I have a company called Cape Cod Neuropsychology, LLC. It's actually only me. I've been doing this for 26 years. Again, on the Cape. Recently, in the last six or so years, moved to Barnstable, right on Barnstable Harbor, which is a nice place to be. And again, I do some treatment, but primarily neuropsychological assessment. So one of the things when Courtney and I were discussing like what people usually ask, people just wonder like what actually is a neuropsychologist and what it is not. So basically, as a neuropsychologist, one has to hold a PhD, generally in clinical psychology. More recently, there are programs that specialize in neuropsychology. However, when I was getting my PhD, I was in a straight clinical program, and then a number of my trainings were in neuropsychological testing. And at that time, it was like a certain number of batteries that you'd have to do before you could actually call yourself a neuropsychologist. We conduct assessments. So basically, we measure behaviors in certain general areas and also specific areas. So we always start with an IQ test, like cognitive ability. We look at new learning. We look at memory, language areas, visual, spatial, executive functioning, and often social, emotional, and psychological areas. So let me just clarify a couple of things there. Not all neuropsychologists add the psychological areas, but most of the time that they do. And then also, generally, we add academic testing if we're looking at school-based issues. So I'll get into that a little bit more later about sort of school-based versus more of like a medical model. And so the testing is sort of very comprehensive in the sense that, we always start out with a clinical interview. We talk to parents. We talk to oftentimes other like collateral contacts like teachers and tutors. We, executive functioning coaches. We gather data through behavioral observations and reports. So we have like these checklists that we give. I'm sure a lot of you have done checklists and seen those. There's a whole variety of checklists, usually around executive functioning, attention, and then the social emotional areas. And then we do the actual, one-to-one testing, which takes place in the office or remotely these days. I'm actually doing Zoom testing this week and last week, and then I had done it for 6 months right in the beginning of the pandemic. So at any rate, we gather the data in a one-to-one situation. Parents often say, like, am I going to be in the room? And I'm like, no, actually, that sort of breaks the standardization. So standardization basically means that you have to give it the exact same way to every single person. You literally have to say the exact same words. So, and then parents have to be out of the office. Now, sometimes, life happens and kids prefer for parents to be there, or you can't do the testing without it. And so obviously there's a lot of workarounds, and we're more flexible than that. But we'll always note that in our observations and our results. And then the assessments result into these like long, comprehensive reports. We try not to make them too long, but it's hard. It's a lot of information. And I specifically like to gear them for parents in particular. So that it's in language that everyone can understand, and also for teachers and people who are helping the child. And obviously in terms of who they get shared with, it would only be the parents, or if it's over 18, the individual, and then they would decide with a signed release in place who they would share the report to. Okay. So then the next question would be like, well, why would you actually get a neuropsychological assessment? There's a whole lot of reasons why people seek out neuropsych assessments. So generally, like, academic issues come up, and does it mean that everyone has to get a neuropsych assessment if you're having trouble with reading? Not necessarily, but it can be a very comprehensive way to rule in and rule out the possibilities. So I see children very often who have issues with decoding, which is sounding out of the words when you're reading, sometimes comprehension, which is understanding what you read, and then writing or math or other academic areas. Sometimes kids come in because of language issues, whether they're having difficulty with understanding, with comprehension or receptive language, or having difficulty with output or expressive language, getting their thoughts out. One of the main questions tends to be around the ADHD. So many of the people who come to me either as a primary or secondary issue want to know if they have ADHD with or without the H. So one thing that's always really important to remember, when I say the ADHD, and a lot of people say, no, it's ADD, not ADHD. So in the latest revision in DSM, which is the categorization we use for psychiatric disorders, everyone is called ADHD. It's just whether or not you have the H in it, meaning like you say ADHD just plain inattentive, or it would be ADHD inattentive plus hyperactive impulsive, which is called combined type, or you could actually have ADHD just hyperactive impulsive type. So, and then I also see gifted individuals, and many times, as Courtney mentioned in the beginning, I see children who have a variety of things, right? So they could be very bright, but they could be having executive functioning issues. And then we use that word twice exceptional to describe children in those categories. Processing or memory issues, again, executive functioning, which goes along with the attention often. Sometimes it has to do with social areas. So I do get a lot of referrals for autism spectrum disorder, ASD, and then also mood or anxiety or psychological issues. One thing I wanted to describe was that years ago, I was probably just like in practice for like 5 years. I remember getting this referral from a therapist who wanted me to see this girl who had a lot of depression. And I was a little bit confused because this girl was literally a straight A student in a private school. And so I said, well, does it make sense that she has a full neuropsych, or does this, have to be a psychological testing, which would be more focusing on the emotional? And she said, there's just something there. It just is a feeling I have, or a sense. And so I said, oh, absolutely, I would do it. So it ended up that in addition to the depression, and maybe depression somewhat being secondary, this girl, even though she was a straight A student, had a learning disability. And it was really important finding, because it really sort of rounded out the picture clinically for her, and it helped get her some additional supports. So Courtney, in between, did you want people to start asking questions, or would you like me to just keep going?
Yeah, if people have questions, you can certainly pause. We can certainly pause on the slides.
Yeah, I mean, I guess,
but there hasn't been anything in the chat.
Nothing in the chat. Okay.
There's nothing in the chat yet. But
okay.
I just wanted to piggyback on what you said, if I may, about the story that you just shared, because I feel like a lot of the times with twice exceptional students, but even with students, we are seeing a lot of times who have an asynchrony of where they're cognitively or intellectually feeling like they could be achieving, and then they're not achieving at that level. And it does result in this internal emotional complexity that they experience, whether it's shame or manifests as anxiety, or it manifests as depression. The emotional piece of that asynchrony can sometimes be a signal that there is a learning disability underneath that has yet to be detected. And as a result, they don't have the skills that but they also don't have the ability to articulate what's happening and such. So I love that story that you shared, because I think it can be a symptom.
I know.
It can be a symptom of something else, as opposed to a primary anxiety or depression, if that makes sense.
Absolutely. Yeah, an interesting thing about that story, which I didn't add, but I will add now. One of the things that came up, because this child was diagnosed with NLD, nonverbal learning disability, and at the time there hadn't seemed to be many like social issues, and sometimes with NLD, but not always, children will struggle with social cues or interpretation of nonverbals or paraverbals. And so I remember this well, because several years later, I was in a school meeting, and the parent was in the school meeting as a professional for another child. And they pulled me aside after, and they said, that thing about social stuff that sort of popped up later for her, like as she got older. And thank you so much, because knowing that information, helped us like predict what would happen, and also, how we could sort of help her and frame that. But the other thing too, getting back, Courtney, to what you were saying, and I think it's super important, it's like anxiety in particular is a really strong correlate or comorbidity with ADHD. And so sometimes, anxiety can sort of look like ADHD and vice versa. And many times you can have them at the same time. So the neuropsych actually serves to tease that out as best we can, to look at that clinically and give more information. So a couple questions came up in the chat. Did you want to say them, Courtney?
Sure. Yeah.
Okay.
So the first one is, could you please elaborate on questions around advanced abilities or giftedness?
Yes. All right. Super important. And when I first did the actual slides, I actually didn't put in giftedness, and I realized, this is another thing that I do and enjoy very much. So most of the times, the tests that I give to determine giftedness are dictated by a program or school that a child may be like applying to, or the parents are looking into. So what I always will say, okay, let's look at their requirement or criteria. If we have any issue about that, we'll call the school. And very often it is simply an IQ test and an academic test. So I will often give the WISC-5 and the WIAT-4 together. Oftentimes it's not a full neuropsych evaluation. Sometimes it's just the two, the cognitive and the achievement. But again, it is generally dictated by a program you might be like applying to. And if it's not, and you just want this general information, then the parent will decide if they feel like getting an entire evaluation would be helpful or not. So I think in some ways it's a little flexible.
Yeah, and just to add on that also, like sometimes you get a neuropsych and it's discovered that giftedness is present,
Mm-hmm.
and that twice exceptional, in addition to a learning disability, and the narrative of someone's life may be helped, right, to be explained if that giftedness and learning disability are discovered in combination.
Yeah.
Yeah.
And in terms of where the qualifications, actually where the sort of cutoffs and the criteria go, a lot of times, again, that's the programs. But so sometimes it would have to be just like a cutoff of like this, drop like 130 or, a number. And then other times it could be in one of several areas. It's not like uniform across every program and every, situation. So, but it does relate specifically to scores, though. I will say to you that while I'm a neuropsychologist who looks a lot at process, meaning that, and I'll get into this in a little bit when I describe the different types of neuropsychologists, meaning how children actually approach problems. When it comes to giftedness, it really does. I mean, I could speak to gifts and talents, but using that term, it is pretty data driven. So
yeah. The other question is, can unmanaged ADHD affect the results of the test so that true abilities are masked?
Oh yeah, well, so when it's interesting because as a corollary of that, the question always is, do I put my child on the medication for the testing or not, right? There's no hard fast rule. It's like, well, if there's a baseline and maybe there's been testing without it, maybe you then want to test on it. But definitely, mask is a funny word though, because, does it mean that they really have those abilities? I mean, I always will say that um, even if I suspect the child is much brighter than they're coming out on the testing, I will say it generally is reflective of their current functioning. So, but that doesn't take away from them their sort of strengths and the areas that, maybe on medication they would have done better. But there is one really important part, and this gets back to the whole idea about process approach. So, like for example, some ADHD kids can get, like, say, an average score on something, right? But they actually can go much farther in the testing than maybe a child who doesn't, because in order to stop any particular subtest or testing, you have to have a certain number wrong. So what you'll see, I mean, it's a little technical, but hopefully you're following me. But what you'll see in this is you'll see that the ADHD child, because of inattentive errors, will get things wrong all the way through, but they'll go to a much higher level of understanding in that subtest, but they still might just get an average score. So in that way, yes, there is sort of a masking effect, I would say, if that makes sense.
Mm-hmm. There's also a question here about your take on something for a particular child. So, Nat, I think it might be best if you circle back maybe in an email to Dr. Acunzo, Dr. Mary, about the biofeedback for her dysregulation and brain mapping and educational testing and such.
Okay, I'd be happy to talk later about that. Yeah.
All right, so next slide.
So what to look for when you're seeking a neuropsych assessment. This actually came in some of the general questions before we started today. So hopefully it'll get answered. So there were a number of things in here that will answer it. So, when you're actually like looking for a neuropsychologist, I think it's important to, sort of do your homework, research the person. We're so lucky now with the internet. I mean, you can learn so much about a person. I mean, there are ways that you can get reviews and things, but you got to be careful about every so often you'll see someone, there might have been not a great review, but you never know exactly what happened there because, I feel like people are more likely to give sometimes one negative review instead of like the 100 positive reviews. So, but I think you have to look into background and lots of different things. So you would ask things like, what cases do you see? So if you're really looking for a school-based eval, you really need someone who does academic testing. So like I said before, I work with another neuropsychologist in my building, and she really doesn't do the academic piece. So, and I'm more of a school-based neuropsychologist. So, that's why I'm talking a lot about the school issues. What ages they see. One of the questions in the prior to the talk was, should my 3-year-old get testing? Should I wait till he or she is 4? So I personally have gotten to the point now where I'm saying school age. So part of that has been more around like during COVID, because it's been very difficult to see very young children during COVID. And I haven't really had the ability, to do that as safely. And I sometimes make exception and see 4 or 5-year-olds, but I would not see a 3-year-old. It also depends on what the person is trained in, right? So I do the WIPC, which is the preschool measure for the cognitive tested, but they tend to be a little bit less reliable, meaning that toddlers tend to just present differently every day. They're just a little less reliable. So therefore the testing is. You could ask if they had a particular type of training. I mean, I don't hear this quite as much, but back in, years ago, 30 or more years ago when I was trained, there was like this dichotomy of the Boston process approach versus the Halston-Raytan battery. And the Halston-Raytan is much more data driven and number driven. And then the Boston process approach is more, like I had mentioned before, like really looking at how someone would derive a score. So like, just as I was mentioning before, like 2 people could get an average score, and it could look different in terms of just how many problems they got wrong along the way. They could also approach the type of test in a different way. So say you're doing a block design configuration, some people might go from like part to whole, some people might outline it first. And so in the Boston process approach, we were taught to really note all of those like various process issues. The next thing you could ask a neuropsychologist is like, are they going to be gathering information from outside sources, like teachers? And generally, if it's an academic based one, they should be, and other people to talk to. So I like to talk to the therapist who's involved. What I like to do, and it doesn't always come out this clean or neatly, but I like to talk to the therapist in between session 1 and session 2 of seeing the child. So then I don't go in with any ideas as much as I want to like know in between, all right, is there another thing I'm not hearing that I need to look at during the second session? You can ask the neuropsychologist if they attend a school meeting, if this is something that's important to you. You can ask also if there's a possibility of a meet and greet. So what I always say to people, like chemistry is a big thing, right? Like not everyone is for everyone. So I always say, like, if you want to just come see me and talk to me, see my office. Oh, and by the way, there's part of my office right there. So, so if you were sitting actually having an interview with me, you would be looking out into the water right there. So as sort of a funny thing, when I grew up on the water in Connecticut and then, moved to the Cape eventually, and I'm a real beach person. So I always wanted to be, as a psychologist, I always thought I wanted to do beach therapy. I had this like, fantasy that I'd be sitting with kids on a beach. And so when people ask me like, are you on the water? And I'm like, actually, I'm on top of the water. So like the water comes underneath my building, which is sort of cool. And sometimes kids actually go play. It's just so funny. So, and then finally, you would ask maybe if there's an intake before testing, like a separate session, because I will 100% of the time do the intake where I'm only meeting with parents unless it's a much older child, like, 16, 17, and then of course an adult. So, and the intake would gather the clinical information necessary.
So Mary, there's a question. How often should you get your child tested?
So if you go strictly by what, well, at least in our state, in individualized educational plan requirements, it would be every 3 years. But, there are times when less than 3 years makes sense. And there are times that you absolutely don't have to do it that long. So, I mean, I would say that I try to look at various junctures, right? Like, so for example, if the child is ready to go from middle school to high school, you say, okay, it's a good time to think about testing, like 8th grade, because then you're planning, right? So those sorts of things. I also look at what's happening academically or emotionally with the child. So, you know, if I'm sort of going by the rule of thumb of 3 years, which, you know, I can go by, but then by 2 years, there's something else has come up. And then I would say, okay, that makes sense. But you can also, you know, you can stretch it out. So I think it's a clinical decision, but the rule of thumb, particularly as you're going with school testing, would be 3 years.
And is there a minimum number of time in?
Oh, yeah. So we talked about that, Courtney. Remember I explained that to you? Okay, so you can never have the same tests within 12 months of each other. So if, say, you had a child who had a school evaluation and then you wanted to seek out the neuropsych evaluation, I could not repeat the exact same test. However, that doesn't mean I can't test the child. I could give the child an alternate version of the test, right? So like we have tons of tests, and so we sort of can pull something else out of our bag.
All right.
Okay, this comes up a lot. School evaluations versus neuropsychological evaluations. I think you're going to hear from me a lot of times. It is case dependent, but you know, there are certain differences, and I'll talk about the differences. So one of the differences is that in a school, you will always have multiple examiners looking at your child. So depending on what the referral question is, you will, again, almost always have a cognitive or IQ test that would be done by the school psychologist. You would always have the educational portion, academic achievement, that would be done generally by the special education teacher. And then if questions come up around like speech and language or you fine motor, and then you'd have those other like specialists. Okay, so the difference then with the neuropsychologist is that we test like almost all those areas. Now, obviously, you know, I'm not a OT or PT or speech and language person. However, I do have a lot of language tests that I would use. In fact, they overlap with the speech and language specialists. And then I would also do maybe a little bit of like sensory motor, and then but not a full OT. So, you know, so then sometimes I would refer on for some of those things in the school, and then I don't do anything related to the PT. So one difference would be multiple versus one examiner. The other would be, again, like covering more of the neurocognitive areas. More and more now, some schools will throw in like some memory testing or some neuropsych testing, but it's generally not considered a full neuropsychological evaluation, and they tend to not do much diagnostic workup. And then a difference with the school is, so generally the school is testing because either the parent has requested or the school themselves have requested this testing to take place, and the end goal would be whether a 504 or an IEP would be put in place. Again, and you know, I'm talking Massachusetts right now. And then, although each state has something equivalent, and then a neuropsych. So the neuropsych would be maybe possibly leading to one of those, but you don't know in advance. Like I always say to people, so I'm going to test your child. I cannot guarantee you that school is going to accept it, but they can accept it either in part, in full, or not at all. So so those are some of the differences. There's like a lot of discussion that could be had around this particular topic probably, but those are some of the differences, and I hope that's helpful. There were a couple questions that came in about whether I'm not going to be talking about adults. So I talked to Courtney in the beginning of today because I got one question about like a 30-something-year-old, and I said, should I be talking about adults? And Courtney, your answer was?
The presentation is geared towards parents and kids. So the 37-year-old was a child though. So right, like an adult child, I believe, right? So I think that it's geared towards school aged children, but I think that the questions that you had related to what to look for in a neuropsychologist, and why you would get a seek a neuropsychological assessment, I think are all applicable to adults as well.
Yeah, I think most of this would be like I get a lot of college students. I mean, that's one of my, I love fun population for me. I love working with college students, mostly because they have usually come to the conclusion that, okay, it's time for me to look at myself and like I want to get help. And so so it's a really nice population to work with. Oh, I mean, I love to work with everyone. But so I see, young adults that way. And I see more and more adult men and women who come in looking specifically for questions of ADHD, and more recently, lots of people with questions about autism. I'm not exactly sure why, but that's what I'm getting.
Mhm.
And I answer all those questions for people who come in like that. Someone said, why would a school not accept a neuropsych testing? That's a great question. So they would, okay, so what generally happens is this. Once the neuropsych assessment is done, um, if a parent chooses to submit it to the school, again in Massachusetts, because some of these things might like change depending on what state you're in, the school has 10 school working days, meaning like Mondays through Friday, to meet on this testing, right? So the parents could waive that 10 days if, say, like they wanted the neuropsychologist to be there and they can't be there. So they might say, oh, well, we can make it in 12 days or something. All right. So then at that point, they often will bring their own school psychologist in. And it depends. Like, so for me, I've been working with these school systems for a long time, and a lot of them even like pull me in to consult or, hire me. And a lot of times it'll just, go smoothly right in and they accept my eval. They don't even have the other school psychologists there, or sometimes they do. But then there are others that are a little more skeptical. They have like people who the school psychologist might like question it, or they might just simply say, we don't agree. This isn't what we're seeing. We reserve the right to test the child ourselves. And that's actually, even if they don't agree, sometimes they will say, we still want to do some school testing. And then if you really do want this child to end up on a plan, usually this is for an IEP, you really do have to submit to the idea of doing some school testing. So
Hopefully that, there's another question that came in. Why does the written report take so long to get from the neuropsychologist? Is 6 months the norm? Getting an appointment takes a long time too.
yeah, I don't know the norm really. I mean, I used to take longer than I do now. I try really hard to get it done within, 2 to 4 weeks. But um, I guess it depends. Depends on whether the setting, like, is it a hospital setting? Are they seeing? I'm not sure. I mean, 6 months does seem like a long time, obviously, because so much can happen with this student in 6 months, and things may be less relevant. But I think, well, more importantly, I think what is important to do is ask beforehand how long the report will take, and then maybe that would be one of the things you're going to base your decision on of who you're going to see.
If a child has had school testing, a medical ADHD diagnosis, and has a hefty IEP, what is the additional value of neuropsych testing?
Say the first part again, Courtney. If the child has what?
If a child has had school testing,
Okay, and a hefty, right? Okay, got it.
And has a medical ADHD diagnosis and has a hefty IEP, what is the additional value of neuropsych testing?
I mean, it depends. I mean, I don't think it's necessary. Probably. I mean, I think if there was an unanswered question, that you're saying like, was there something else that the school's missing? If you want another opinion, but no, it's not necessary. I mean, I've sometimes like there are people who come to me who have very comprehensive, excellent IEPs, and and I think they're sort of covered. But sometimes parents just want some additional information. So it might be like something has developed that's new. It might be the emotional piece that's come up, like some anxiety that was secondary. But yeah.
The only other reason that I can think of at this moment is if the child is college or about to be college age,
Mhm.
sometimes it's required to submit as documentation to qualify for accommodations in the college setting. Not always, but sometimes.
Well, the one thing that is absolutely required would be a WAIS-4. So that would be the adult IQ test, right? And then I think they do like having the neuropsych usually. And by the way, that's not submitted with an application for a college. In fact, it's only submitted after the child has been accepted, unless you're applying for a specific program. So like sometimes, like for example, the PAL program up at Curry, or say you're applying to Landmark. So those types of situations, you would include the neuropsych with the application. But it is helpful, definitely, especially for services.
Yeah. And then there's another question. Does it matter, like, should you have the school evaluation done first and then the neuropsych, or does it matter which one is done first?
Oh boy, if I had the answer to this one, I'd be so happy to tell you, because it's not a cookie cutter thing. It's like, it's very case dependent. So I will often ask some of my advocate friends about this. I would say, what do you think? And she's like, well, let's look at this and look what the history is.
So it's a case by case basis?
It is a case by case, but I mean, there are a couple things to think about, right? So like, if you never had any evaluation at all and you just want a full, like, comprehensive eval, you might lean towards getting a neuropsych. But then again, you may know that they might get some school testing too. I think a lot of times what does happen is maybe the parent is not satisfied with a school evaluation, or feel like it's incomplete, or they want more. Then they go on to the neuropsych. But remember, if it's within 12 months, like, I can't redo the IQ test or anything like that, but I can give some alternative tests for other areas. So it depends. And then
we've had a lot of good questions. Heather, you have a great question about Landmark. I'll do some research. I'm going to see if we can keep the presentation with Dr. Mary going, and I will see if I can come up with the link that can help identify what's required at Landmark. That is most likely.
I think it's a full neuropsych.
Yeah. Share that on their website. And I'm also aware that it's almost 8:15, which is what we advertised this would go until.
Right.
But I want to let you know that we will continue this. If you need to go, we totally respect the fact that you may need to leave. We will continue sharing the information, and it will be recorded so that we will get it out to you in the recording format if you have to leave. We'd love for you to stay, of course, but if you have to leave, we totally respect that need.
Okay. It's one of my favorite parts, really, of my talk, or this, or actually of my job. So how to talk to your child about your testing results. So to me, this is so important. I mean, the idea of having a child or an adult, anyone, go through testing and not get direct feedback just doesn't seem right. So I think it's so important. And there's a number of things about this I want to talk about. First, I will give parents, again, this is my practice I'm talking about. I will give parents full feedback about everything that went on with the testing. Now, I do one of two things to bring the child in, right? So I'll either say, if it's comfortable, and for a number of kids, it's not, they could be in the waiting room playing. A lot of times they're on their parents' phone. And at the end, for 10 or 15 minutes, we give a synopsis. I give a synopsis in front of the parents about, how they did. I give them feedback. A lot of times, though, I will do a separate session, and now with Zoom, it's always separate. So the question that comes up a lot, parents want to know whether they should use the diagnostic label. So, like, I don't want to tell my kid he's got ADHD. I don't want to use it as a crutch, or, there's so many things. And I totally understand those concerns and questions. However, this is the way I think about it. A lot of times, this is why the child is being put on the 504 or the ed plan, right? So they're going to be in school working with a professional who is going to be referencing the issues at hand. And they may even say, well, that's because of your ADHD. Now, should they say that? Maybe not. However, it may happen. So my feeling is it would be better for the child to just hear it from the examiner and from the parents than to hear it from someone else. And I also think that at any given point, given the right developmental language and everything, children should know about their like learning styles and habits and strengths and areas of struggle. One of the things that I really like work towards with parents, and I know this is hard. I mean, we've all fallen into this, right? Is trying not to like give global feedback to your child when they're struggling. So, for example, kids, will come to their parents and say, "Oh, I'm do better. I can't do this," or because maybe they're having problems with a math problem. So I tried to tell them to veer away from using like, no, but you're smart. Like we know how smart you are. Because for them, the child just feels like, no, 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 you're really not hearing me. Like that invalidates them, even though that's not what we're trying to do. And we all have done it at some point. But what I prefer to have parents do, and this is the one of the important outcomes of testing, is to just say, oh, remember, like either remember, Dr. Mary said this, or, you know, this is one area you struggle in. We all have struggles, but then this other area, you're stronger in. So just to be like descriptive when you're telling your kids about sort of giving them feedback. The other thing about talking to your kids about testing results, I love when parents chime in and give examples, So for example, I would say, something about multi-step directions, and the parents would be like, okay, so, Susie, that's when I tell you to go upstairs, you know, undo your bag, brush your teeth, put on your socks, whatever, and come down. I don't know why anyone would to say that many things, but people do. So, and then they're like, "Oh, right, mom, I can only do one of those things." So I love when they give like real world examples. And then I also love when kids ask me questions about it. They'll be like, "Wait, what does that mean for this?" Or more often than that, I love there's like, "How did I do on that test where I had to draw that weird picture?" And so I'm like, "Oh, here, let's like take it out and look at it together." So I always ask the kids, like, "Would you have a specific question about how you did on a test?" And then sometimes they come up with the most interesting things, as you know, because kids are great. The other thing is for me, all this information is like planting seeds of metacognition. So metacognition is something that Courtney and her colleagues work with kids on all the time, right? So we want to teach kids to think about their thinking. And that's basically metacognition. We could have a whole talk on those things, but that's not for tonight. And then to just revisit and reference the results over time. So that's why I love having parents in the room with kids so that they can hear the language that I use and then they can reference it.
All right.
And then what do you do once you get your results, when you get the report, besides, talking with your child, obviously, which we just talked about, submitting it to the school, presenting it to the primary care physician, therapist, specialist, following the recommendations. So a lot of times I'll say, okay, the child might need an eye appointment, not just for acuity, but a vision appointment, but also for, say, tracking, if it has to do with reading. Implement strategies provided. So I try to give very specific types of strategies that I think would suit the child's learning. But I also then say, it's not like we're going to say like, okay, Susie, you can go do that now. But this would be where they would get support from Courtney, or where they would get support from their special ed teacher. And then always keep your neuropsych evaluation for future. Because, for people like me, when I get someone and they said, oh yeah, we had another eval, I can't find it. Like, oh, because it's great to have a baseline. So, oh, and then there was one other thing. Oh, I know what I was going to say here, Courtney. You and I talked about this. And I don't know how many neuropsychologists do this, but this is something I've developed over the last like 8 or 10 years. I will often do a separate school report from the general neuropsych report. And I will specifically say school report on the top. So I think they know that's specific, that's for schools. So I do that in instances where there's very personal or private information a parent may not want to go to the school and for whatever reason, or like say when I do the psychological or emotional testing, I'm very specific about what the children or person they're saying. So for example, if they endorse certain items or if they say certain things on like a sentence completion, I actually put like statements in the report about like their innermost thoughts and feelings. And I just don't think it's fair to have them have that always shared with the school. Like that's for the therapist, that's for them. I use that, I put that in specifically so that the therapist who might be doing like cognitive behavioral therapy can actually work with some of those statements. Oh, okay. So look, so this is where we come out to have a snack and we look out at the water, the Barnstable Harbor. And so my little saying that I do say to most people is that no one ever leaves my office wishing they knew less about themselves. So basically that the neuropsych testing, well, I don't think every person in the world necessarily has to have one, although I think a lot of people would benefit. I just think that the people who leave there feel very comfortable knowing that they have a nice outline of strengths, a nice like description of challenges and direction. So getting back to my 3 takeaways, the neuropsych assessment is an intervention, not just an assessment. It makes movement for a child, or for an adult. I recently saw someone who I diagnosed with dyslexia, and granted, it wasn't just because of the testing, but like within a month or two later, like things were just starting to click about the reading, and it partly was the testing in the sense that I had identified that the child was getting 3 different forms of reading instruction, and they were all different. And so, one of the biggest interventions that I made around that was just talk to all the different people who were doing it. We eliminated one, we kept 2, and we made sure they were doing the exact same thing. So it makes a very large difference in a person's life, I think. The third is just, the most important thing is the support it provides. It's great to learn about how, we learn and how children learn, but it's great to figure out what the actual support is. So how does that translate into the actual recommendations? And then finally, highlighting strengths as much as challenges gives us inroads to figure out how to use those strengths to offset any problem areas. So to me, those are like the 3 really big takeaways about why I think neuropsychological testing is super helpful. And there we go. And at the end of the day, and this is right down the same beach where my office is, I just think we all want to be, comfortable and have happy, healthy, well-adjusted kids and have that for ourselves. And this type of testing is one way to help with that.
I'm going to stop sharing. Thank you so much, Dr. Mary, for all of that. Great information. I don't know if, I know it's close to 8:30. We'd like to wrap up no later than 8:30. But we do have time for more questions and answers if people have additional questions that they'd like to have asked.
Hey, Mary, this is David.
Oh, hi, David.
Can you hear me?
Yes.
Awesome. Excellent job. That was awesome. I really appreciate your time tonight. It's so valuable. Working memory tends to come up a lot in our work as a concern, as a topic. I would just love your soundbite on how you evaluate working memory when you do evaluations.
Sure. So, first of all, I try to describe working memory as basically, the type of memory that we use, or the part of our brain that we use to execute tasks or directions in a small amount of time. So, like for example, before we had GPS, and people would say to us things like, "You get to the stoplight, you take a right, you go 2 more blocks, and you take a left." We would have to keep that in what's called our working memory. I think they refer to it as like RAM for computer, right? So it's like it's that working thing. So it's not like short-term memory that we're like learning things. It's not long-term where it's like we need it for retrieval and for information. It's literally to execute a task. So that's why it's part of the executive functioning branch. And the way that I test that, the way that neuropsychologists test that, is we have a variety of things. So, for example, like very concrete tests would be like repeating things forward and then backward and then in order, like digits. That's like sort of super hard for certain people. Looking at the order of things and remembering the order of things. A lot of like sort of not just repetition tasks, but manipulating information in your head and giving it back. So, and then we try to do it both in terms of a verbal method and a sort of a more visual method.
Yeah, that was going to be my other question too, is when you look at the deficits within working memory, is it important to tease out the difference between deficits in nonverbal and verbal? And what would be some of the consequences, or shall I say the challenges in those areas?
No, I think it's always important to tease those things out in any parts of the learning, because for some people, the visuals will help them. I think that the consequences or the implications would be like, so say, for example, like, all right, one specific test is called picture span. And this is fairly new. And I like it, quite a bit, because it gave sort of a visual corollary to doing the digits, because that was more verbal. But one problem with it, though, it tends to lend itself to verbal mediation. So you can tell yourself the labels of those pictures and remember the label. So sometimes it's hard, but I prefer, there are some tasks that you can look at, which they'll be a little more sort of configural or like geometric or something. And then that will give us information about like making pictures in your head, right? So like when you're working with a student, if you know they're very good at sort of making pictures in their head and they can repeat it because they remember those pictures, you're going to be able to work with that strength in a different way, right? But then if you know that they can sort of make these verbal labels or they can remember the sounds, then you're again going to intervene differently, right? I mean, for some kids, there would be a difference between those two things. Like, for example, though, but then sometimes there's a little bit of confounding variable here, because like the other day I was doing digits with someone who's on the spectrum, and I was just in shock and in awe. I couldn't believe how many digits this person was able to say till the end, and then even backwards and in order. And it was very clear that he was actually like writing them and visualizing them in front of him. So that's part of the reason why I'm always like inquiring with kids, like, like when I get a sense something's happening, I'll be like, what were you doing there? And then they tell me. But so it's really important to know, like, not just that they're doing well on that task, but what they're employing to do it. So David, sometimes it's like, so that's why it's important, David, when you're reading these reports, right? Hopefully the person like me is writing how the person did it and how they approached it, not just like the score, because that's more important than the score. Does that make sense?
It really does. And there's 15 people left on this call, and all 15 of us love geeking out on this stuff. So we can just go hours.
I could too, actually. I love it.
These are the diehards hanging in there with us right now. So I really appreciate your time, Mary. This is just so helpful, and hopefully to everyone that's participated, and
great.
And just kind of giving a really powerful soundbite onto this very complex process that you have a passion for.
Yeah. Thank you so much for having me. It was really enjoyable.
All right. So I, just to wrap up, I'll be sending out the recording. I'll be sending out Dr. Mary's slides. If you would like to get in touch with Dr. Mary, I can also include her email or her website.
Sure. Yeah, well, if you go to the website, the email is right there.
All right, so I can include the link to the website for anybody that'd like to follow up and get in touch with her. And if anybody has ideas for future webinars, please send those ideas my way. And you'll be getting the email from me. So you'll have my email that way also. All right. Thank you so
Courtney.
much.
Thank you, David.
Have a wonderful evening. Bye, everybody.
Bye-bye.